Well, good day, everybody. This is Dr. Murray from Murray Natural Integrated Health here in Hastings, Nebraska, doing a short video here for you today. Today, we're going to be talking about the 5 tests your doctors don't normally do. And we're talking about fatigue, we're talking about inflammation and weight gain all today. There's so many times, I know that you know it, you've gone into your physicians and you have a complaint, you have a concern, you have a problem. And maybe that's that you're just wiped out all the time. Perhaps you have foggy thinking. Perhaps you have a lot of bowel bloating or something like that, or maybe even you have joint pain. You go in and you have lab tests done, you have some procedure done to kind of check out and see why things are going on. And guess what? Nothing is found. They say, yep, everything's fine, come back later. And that's the type of people that come to us on a routine basis, or those who have been to their physicians already, nothing's really found, and they just aren't getting any answers. Problem is that a lot of tests are not done that need to be done and should be done, even according to medical standards, should be done, and they're not being done. So we're going to talk about multiple tests here today, 5 different tests today that your doctors don't normally order, not routinely, that do have an impact, can have certainly have an impact on fatigue and inflammation and weight gain. So that's what we do in our office here, is do a lot of functional medicine related testing and trying to get to root causes of problems. So you can go ahead and give us a call if you have questions about any of these things. Okay, so first of all, thyroid testing, that's like the number one, always everybody thinks about, because there are a lot of times you'll go in and the thyroid is tested routinely, and not everybody needs to have every extensive thyroid testing test done, under the sun. But there are a lot of times that the standard TSH or the standard T4 testing is not enough. A lot of times people are taking levothyroxine or taking Synthroid or they're taking Cytomel or some other types of thyroid hormone, and it's just not doing it for them. They're already being treated and they say, well, I'm being treated, I'm taking thyroid medication, but I'm tired and wiped out all the time. They tell me my numbers are normal, but they're just not looking at it all. Sometimes you need to do the more extensive testing. So the more extensive testing than just your TSH and your T4 would be, of course, your free T3 and your free T4 and your reverse T3, some of those numbers, but also more specifically, your thyroid antibody numbers. And even more specifically than that, how about a thyroid ultrasound? There's all kinds of people who are taking thyroid medication who they know they have a thyroid condition, but their providers have never ordered a thyroid ultrasound. Listen, if you've got a brain problem, you normally have a brain test. If you have a heart problem, you have a heart test. If you have a thyroid problem, you have a thyroid test. And if you have a thyroid problem and it's not really being totally addressed, you need to have a more extensive thyroid test. And so there's so many people that they know they have like Hashimoto's thyroiditis, or they have Graves' disease, but they've never had an ultrasound of their thyroid performed. It is good as long as the test isn't too invasive and too expensive to have testing done to establish a baseline. Establishing a baseline on thyroid testing or on sex hormone testing, testosterone or estrogen, or on any kind of test, including a thyroid ultrasound, is a great thing to have a baseline anyways. So having a thyroid ultrasound, looking for those cysts, those lumps, those bumps, seeing if there's any correlation between that and perhaps the thyroid condition that's there, maybe a correlation between that and the antibodies that are present. So if you have a thyroid condition, you're taking levothyroxine or Synthroid, one of those medications, very likely that you're going to have, around 80% of the time, you're going to have thyroid antibodies high, meaning you have an autoimmune condition attacking your own thyroid. Well, in the month of January, since it is Thyroid Awareness Month in January, we do offer, so if it's now or in the future, in January, we do offer a free thyroid ultrasound screening. So if you would like to have a free ultrasound screening, point of care ultrasound screening, where we are looking at the size, looking for cysts and mass and those things, And so a lot of these people, we'll refer them out for continued or additional testing if needed. But it is important to have those tests done if you have a thyroid condition. And of course, the thyroid most certainly can have an impact on inflammation, on fatigue, on weight gain. It's an important one. So, thyroid testing, a complete thyroid test, antibodies, and a thyroid ultrasound. And in the month of January, we do a free thyroid ultrasound screening. So, go ahead and give us a call if you'd like to do that. Secondly, a spirometer lung function test. How many of you have fatigue and it's getting more difficult for you to even go up and down the stairs? You're kind of wiped out and tired. You can't actually, it's like you can't even catch your breath, so to speak. Maybe you have allergies. Maybe you also have a diagnosis of asthma, and nobody has ever done a lung function test. Your lung function does decrease every year, but through a pulmonary function, a PFT, a pulmonary function or spirometer test, you can look at the actual amount of lung volume that is normal for you based off your age and compare that, of course, to normal and see where your forced expiratory volume is and your forced vital capacity and look to see what your lung capacity is. Now, remember this, oxygen is pretty important. You need to have enough oxygen so that you can, so you can live, so your brain can survive. And those that do have reduced pulmonary function will have more fatigue. They also will have more difficulty in losing weight if they have pulmonary issues. You have to have oxygen to actually burn calories. So for your cognitive function, for everything, your lung function is important. And also from an allergy or asthma standpoint, you're taking allergy or asthma medications in particular, you're supposed to, it is according to protocol, to have your pulmonary function test if you have asthma, to check and see if your pulmonary function is reducing, because we know that chronic asthma can also cause damage to the parenchymal tissue of the lungs. And it's important to know what the status of that is. Some people are taking asthmatic medication and actually they don't even need it anymore, but they keep on taking it. They should have had their lung function retested to see if they actually need it, and they haven't had it retested. So a spirometer pulmonary function test is super cool, super important, easy one to do. We do those here. Your other providers do that as well. So you can certainly ask for that test. Another test of these 5 tests that your doctors don't normally test for, and that would be a sleep study. Very important. If you are having fatigue and you don't understand why, weight gain, you don't understand why, you're just wiped out throughout the day, daytime sleepiness, you should be kind of evaluating what's going on inside of your sleep habits. Your sleep is so important. I know people know this, but if you don't know what's going on when you sleep, and if you have difficulty sleeping, you should have a sleep test. I said before, if you have brain problems, you need to have a brain test. You have a heart problem, you need to have a heart test. You have sleep problems, a sleep test is a good thing, because if you're not breathing at night, that is crucial and can be pivotal when it comes to healing, repairing, and self-regulating. When it comes to burning calories, you need oxygen to actually burn calories. So if you have sleep problems, you may have low oxygen status at night. So having a sleep study, and it is not ordered very often. We test that all the time in our office here, and we find sleep apnea all the time. And it doesn't necessarily mean that you need to always have a CPAP. There are other options to get your body healthier so that you can help your body to breathe more effectively at night. There's dental devices. Of course, there's weight loss issues, things you can help accomplish that as well. Sleep study, another important one. If you're low on oxygen, if you are, then you're needing oxygen more than you are vitamin D, or more than you're needing perhaps many of the medications that you might be taking too. Oxygen is important. A sleep study sometimes is very crucial, very important. Sex hormones, another one. This is of the 5 tests that your doctors don't normally test, sex hormones is definitely one of them. You and I both know that generally speaking, when you go into a physician's office, you say, and a lady says, hey, I'm having hot sweat or night sweats and I'm hot flashes and these types of symptoms, they're normally going to say, well, you know what? You can take hormone replacement therapy. There have been fewer amounts of traditional hormone replacement therapy protocols being utilized in recent years because they know just throwing estrogen at something can be deleterious, can be dangerous for people. But I would have a whole lot more respect, even for traditional kind of synthetic hormone utilization, if they just tested and they said, hey, where are the numbers here? Maybe we should bring up those estrogen levels up to kind of normal levels based off of post-menopausal ranges. But it's not just about post-menopause either. It's also about hormones in particular. How many patients have come into our office who have had a complete hysterectomy or a partial hysterectomy? They go in and they talk to their physicians, and their physicians say, well, you're just getting old. And they talk to them about hormones. Well, you don't need any of that anymore. You're old. That is ridiculous. You should have a normal amount of hormone of estrogen, progesterone, testosterone, whoever you are, based off your age. It shouldn't be too high and it shouldn't be too low. It's important to have those tested, and that's not tested on a regular basis from your physician's office. And that is one of the 5 tests that doctors don't normally test for. And it can affect your sex hormones, most certainly can affect your fatigue, your inflammation, weight gain, all those things. We know that because your metabolism is partially predicated on your sex hormones. So you can have your sex hormones tested for. And that's exactly what we do here on a regular basis. Why do we do it? Because so many other places won't do it. You got to get to the root cause of the problem. If you have low bone density, if you have cognitive problems or tummy problems or weight loss issues, it could be related to your sex hormones. It's time to get to the cause. Lastly, another category here of the 5 tests that doctors don't normally test for would be your lipoprotein testing. Some of the more specialized cardiac related testing that is so crucial for patients and can most certainly have to do with fatigue and inflammation and weight gain and all those things. And the reason why is because some of these things are essential for your health. So for instance, some of these cardiac tests that you can have done, which would include your lipoprotein testing, which is your particle size testing, and your LP little a. I know these are kind of technical terms, but these are things that are definitely cardiac related tests, but they have implications for the entire body, including your omega-6-3 ratio. Lots of people are taking fish oils out there. I get it. When we test omega-6-3 ratios, when we test somebody's fish oil content and also their other grain oil, seed oil content, we find a lot of people are very, very high in omega-6 oils, and they're also very, very low in omega-3 oils. And these are standard cardiac related panel tests that you can have done, but hardly anybody tests for them. Well, if your omega-3s are low and your omega-6s are high, you statistically are more likely to be on the higher weight side. You're more likely to have more inflammation. You're more likely to have other cardiac related problems. You're also more likely to have fatigue and just wore out because you are in a constant state of high inflammatory status. So having your omega-6-3 ratios tested, important. And around here, I don't know anybody's testing it besides me. I'm sure there is a couple places, maybe 40 or 50 miles from here. But in our town, I don't know anybody else is testing that. And it's a standard test that are on cardiac related panels from Quest Diagnostics, LabCorp, big nationwide labs. You can have these things tested, but nobody's testing for it. And that can be one of those factors that affects your fatigue and inflammation and weight gain that your physicians are not testing. All that being said, there's so many things that you can do without any kind of testing whatsoever. Things that you can do to get your body healthier than you were the day before. You just need to start to grab onto the things you know are good or you know are true. Start doing those things. Start to try one thing today to get yourself healthier than were the day before. But if you're needing help, there's lots of ways to assess and see where are you lacking something, where are you deficient in, what's going on with your hormones. Your hormones most certainly affect how you feel and affect your metabolism. Are you deficient in vitamin D or B12 or omega-3 fatty acids? Perhaps your cortisol levels are high. Maybe you have some type of dysbiosis or abnormal microflora in your intestines. Maybe there's mycotoxins. Maybe there's something like that going on. Nobody has to have a bunch of tests done all the time, but you should listen to your body, because when you're having problems and you have pain or discomfort, something's not right. It's your body talking. but we need to listen. We need to listen. And that's what we do in our office here. The 5 tests that your doctors don't normally order, that's what we've just talked about. Give our office a call, 402-463-4257, and we'll help you out in any way that we can. Murray Natural Integrated Health, setting the standard in natural health care. Have a blessed day.